Hi, my name is Allison Brown, and I'm a student at the University of South Alabama College of Nursing, and I'll be doing my medication administration checkoff today. So these are my surroundings. And the first thing that I'm going to do is talk about that whenever I'm preparing medication, I'm going to have the door closed. I won't be taking any phone calls, and I'm going to limit the conversation with my colleagues to just what's important. And I would also follow my agency's no interruption policy. So now what I'm going to do is just go on my MAR, look on my MAR compared to my patient care order form. And I'm going to look at the name of my patient first, which is Jaguar J. Jones and Jaguar J. Jones. Date of birth is 08/25/1963. Date of birth is 08/25/1963. The next thing that I'm going to look at is the medication that I'll be preparing. And my medication is heparin, so I'm going to find heparin on both of them. So medication is heparin. The dosage is 5,000 units, 5,000 units. The route is subcutaneously, and the time is every 12 hours. And the indication for it is heparin is an anticoagulant, so it's gonna deal with blood clotting. So now what I'm gonna do is move into my first check. So I'm just gonna use my MAR. So for my patient again, I have Jaguar J. Jones, and my medication is heparin, and the dosage is 5,000 units, and it's subcutaneously. So I'm gonna pick out heparin, and the expiration date is 12/5/2025, so we're in date. I'm gonna set these other ones to the side. And then since it is subcutaneous, I'll be using a 28 gauge 1/2" needle, which is that. So now what I'm gonna do is draw up my medication. So I'm gonna clean the top of my vial. And then I'm gonna pull air. Since this is dosed at 10,000 units per milliliter and we only need 5,000 units, I'll only be administering 0.5 units. So I'm gonna pull up 0.5 units of air. And then once again, make sure that vial is clean. And then I'm gonna take the cap off and inject it and push that air into it. And then pull down my med. And since this is a heparin shot, I would verify it with another nurse. So I'm going to use the scoop method and pick that needle up and recap it. And then I'm going to continue with my first check. So for the time of it, it is every 12 hours, and my patient hasn't had it within the last 12 hours. So we're good to go with that. And then the indication again is for blood clots, since it's an anticoagulant. And then for my documentation, I would document the entire legal prescription. And then after I administer it, I would document any reactions that my patient had. So now I'm gonna go with my second check. So I'm gonna go through that again. So Jaguar J. Jones is my patient's name. The name of the medication is heparin. Dosage is 5,000 units. The route is subcutaneously. Time is every 12 hours. The indication is for blood clotting, since it's an anticoagulant. And the documentation would be the entire legal prescription. So now what I'm going to do is prepare a label. And on that label, I'm going to write my patient's name, the name of the medication, and then my dosage. So let me do that. So the name of my patient is Jaguar Jones. and he is receiving heparin dosed at 5,000 units. And now what I'm going to do is I'm just going to place that on my syringe. And I would use hand hygiene before I drew that up. So now what I'm going to do is go to my patient's room, and with me I'm going to take my syringe with my medication that I drew up. And before I go in there, let me show you that I do have 0.5. Yeah. And then my heparin vial. So I'm going to take all 3 of these to my patient's room. Okay. So now that I'm in my patient's room, I am going to hand hygiene, and then I'm going to start with my 3rd check with my patient. So here's my patient, and we're going to first check that this is the right patient. So we're going to look on the MAR, and we're going to look on the wristband. We're going to make sure that we have the right name. So Jaguar J. Jones. Jaguar J. Jones. Date of birth is 08/25/1963. 08/25/1963. And so now what I'm going to do is just explain the procedure to my patient. I'm going to let him know that he's going to be getting heparin just for blood clotting. And I'm also going to lower the side rails and raise the bed up. So now what I'm going to do is look for the allergies. So it says that he does have a penicillin allergy on his wristband and on his MAR. I would ask him if he had any other allergies that he would like to tell us about. And now what I'm going to do is we're going to lay him down. And I would do any pre-assessment that is necessary, so like taking his vitals and his blood pressure before he was to get the medication, so just in case anything happened, we can monitor it. So now what I'm going to do is continue with my 3rd check. So we did patient, so now we're on medication. So again, we have heparin, and heparin 5,000 units, and then on our MAR, heparin 5,000 units. So yeah, for the dosage, 5,000 units, 5,000 units, 0.5 since this is dosed at 10,000. And then for my route, on my MAR, it is subcutaneous, so we do have the right needle for that as well. And then time is every 12 hours, and he hasn't had any in the last 12 hours, so we are good. And then indication, heparin is an anticoagulant, so it's going to deal with any blood clots. And then again, for my documentation, I would document the entire legal prescription, and then after I administer it, I would document any reactions that my patient had. So now what I'm going to do is I'm going to put on my goggles and my gloves. And we're now going to look at my patient's skin integrity, and since it's subcutaneous, we are going to be giving it on his stomach, 2 inches around the umbilicus, and we will be going at a 45-degree angle as well, since I can only pinch 1 inch. So now what we're going to do is clean our injection site from the inside out. And then, like I said, we're doing a 45-degree angle. So I'm going to pinch and inject. And then I'm going to hold over that with my alcohol pad. So the next thing that I would do, I would just assist my patient to a comfortable position, and I would raise those side rails up and put the bed back up, lower the bed down to the resting position. And then I'm gonna remove my gloves, and my goggles, and I'm gonna wash my hands, do some hand hygiene. And then the next thing that I would do is just document again my entire legal prescription, and then I would also monitor my patient and return as needed, and also document anything that was good with that. Also, I want to add that it wasn't in the frame, but my sharps container, my needle went immediately in there, and I did not recap it. And that is my assessment.